The media has stirred up the coronavirus, which is a severe acute respiratory infection, otherwise known as COVID-19, which stands for coronavirus discovered in 2019. They tell us that it massively affects the elderly, resulting in death. Many of the elderly have dementia. Hello, I'm Janet Rich Pittman, a former dementia healthcare administrator and dementia practitioner, where I was over 3 dementia lockdown facilities. Now, as a dementia practitioner, I specialize in dementia prevention and dementia reversal. And yes, many of our elderly have dementia. The British Medical Journal tells us in a meta-analysis study that in some communities, the rate of undetected dementia is as high as 90%. Those whose brain is slipping, who have any form of cognitive impairment, whether they are diagnosed with dementia or not, are at risk. When you have dementia, the brain is on fire with hyperinflammation and no tropic support. The brain is weak. And since the brain controls the entire body, the immune system of the entire body is challenged or weak. And with a weak immune system, the body cannot fight off any infection. Coronavirus is a virus which attacks your immune system, beginning in your lungs, leading to infection, resulting in death caused by sepsis or blood poisoning. While heavy antibiotics kill sepsis, treat sepsis, heavy antibiotics also kill your microbiome. Your microbiome is the activity of your gut brain, and this microbiome instigates communication to your head brain. Your microbiome controls your digestion and your body's metabolism. It's our second brain. Now, if you've been someone who's taken antibiotics back to back recently for a series of illnesses, or you're someone who's taken antibiotics a good deal of your life, your microbiome may be very weak and not functioning properly. And this dampens or weakens your immune system. When your microbiome does not function properly and is very weak, especially from long-term antibiotic use, illnesses result, specifically dysbiosis, adrenal fatigue, thyroid issues, IBS, constant diarrhea, constant constipation, massive constipation, brain fog, cognitive issues, kidney trouble, heart disease, all the way up to cancer growth. These illnesses are side effects from using too many antibiotics. And what makes the situation magnified or exacerbated is when antibiotic use is combined with other medications. The miracle drug with virtually no side effects for sepsis is not antibiotics. It is the HAT treatment. Doses of IV administered hydrocortisone, which is a steroid, ascorbic acid, vitamin C, and thiamine, vitamin B1. And this recipe was comprised, or it's really a protocol developed by Dr. Paul Mark, a critical care physician at Centara Norfolk General Hospital in East Virginia, and as proven in a scientific study published by the journal Chest. His retrospective showed, and I'm going to read the recipe here, showed giving patients 200 milligrams of thiamine every 12 hours, at 1,500 milligrams of ascorbic acid every 6 hours, and 50 milligrams of hydrocortisone every 6 hours. For 2 days, reduced mortality from 40% to 8.5%. There is a synergy with B1 and the steroid hydrocortisone, along with vitamin C, to crank up the immune system. Now, vitamin C itself is a potent oxidizing agent. It energizes organs, and when given in high doses, it can eliminate pathogens or bad germs. Mainly, vitamin C is a strong, significant fighter, reducing inflammation. If you have an elder in your family who has dementia or perhaps a weak immune system, immediately get them on a series of high doses liposomal vitamin C. And this is something that you might want to consider too. If you suspect COVID-19, understand that if it affects the elderly, especially those with dementia, sepsis is primarily inevitable. Know about the MARC protocol. Communicate it with your doctor. If you find you're at the emergency room, communicate it with the staff. Here I've given you an image of the 5 pages of trials and studies that prove the HAT protocol works. The link is attached. Bottom line, for the elderly, for those with a weak immune systems, for us all, we can fight this disease. We can beat it. We've just got to stay healthy. Wash your hands, cough or sneeze into your sleeve. Make sure you don't touch your face and eat your vitamin C. Eat clean. As a side note, red bell peppers have the most vitamin C per concentration of any fruit and vegetable. So eat your vitamin C and as well take a liposomal vitamin C. Now let's do a bit of a chemistry lesson here. Each cell of our body is comprised of a composite of oil, a layer of oil around each cell. Most of our nutrients are water-based. As we all know, water and oil do not mix. So we've got to have something to get the water into our oily cells. So a liposomal vitamin C is an encapsulated ascorbic acid that is encapsulated with a fat coating, and that helps mimic IV infusion, substantially helping with absorption. Again, vitamin C snaps into operation. It broadcasts the antioxidant chain reaction to fight inflammation. Fighting and finding the cause of this hyperinflammation is a key step in my dementia, Alzheimer's, reversal, and memory retention protocol. I cross-reference each of these steps with your current condition. Successfully going through the program brings back your cognition and provides good brain health for the rest of your life. If you'd like more information on this 9-step Alzheimer's reversal memory retention program based on scientific studies and clinical medical trials, here's the link, and I've included it also. On my website, schedule a free 10 to 15 minute call to see if I can help you or yours. In regard to this current COVID-19 Wuhan flu scare affecting our elderly and our demented victims, most probably you will be the contaminant. So you stay healthy. You take care of you. Again, eat your fruits and vegetables, eat and take your vitamin C, wash your hands, don't touch your face. I'm Janet Rich Pittman, a dementia practitioner specializing in dementia prevention and dementia reversal. Wishing you and yours the very best in good brain health.